The following piece of creative writing that I will be reading is titled Leave It at the Door. I wrote this piece of writing during one of the worst parts of the pandemic of the coronavirus for my local community. So please keep that in mind when listening, is that this was written during a really tough time for my community. Now, since then, my community has recovered and we are not in the same position that we were then, and we still see some of the coronavirus, but not like we did during this time period when I wrote this, thankfully. This is Leave It at the Door. This is a phrase that has been etched in my mind since nursing school. It refers to the concept of leaving our personal issues at the door when walking into a patient unit, arriving as a willing vessel, ready and committed to service for others, whatever the shift may hold. As many of you know, I left home health care after 11 months and returned to hospital nursing in late August 2020. I have been training and working as an ICU nurse and have stepped into my familiar role as a medical surgical nurse some days. I enjoy working at the bedside of hospitalized patients. There is so much joy to be found in observing and aiding the progress of healing. COVID-19 has shaken and turned the progress of healing upside down. There is no rhyme or reason to some of the things we observe in patients with COVID-19. There proves to be more setbacks suffered with this illness than I have ever seen a hospitalized person suffer with anything else. I see many people with no healthcare experience still insist on comparing this to the flu. It is so much worse if only you could see. I couldn't help but to wonder yesterday during my shift, if the public could see inside these walls, would they see this the way healthcare providers do? Would they see the pain and fear in the eyes of others that we see? Would they see the patient struggle for air and have compassion? Would they stand back in fear of all the plastic draping, the sound of people calling, the complicated machines, all the lines and tubing, and all the sounding alarms? Or would they find the inspiration to be brave? Would they cringe that discussions of body bags, chest compressions, and impending death have become a more frequent, routine occurrence? Would the public believe what they see? Would they acknowledge our perspective and the realities attached to it? Or would they discount each person's experience and simply ask which comorbidities these patients had that made them more vulnerable to this illness? I have to admit, it is difficult to leave ourselves at the door some days. We have all been there. I brushed these thoughts away for the time and pressed on with the tasks at hand. Even as it seems much of the public is still somehow in denial that the COVID-19 pandemic is actually happening, we healthcare providers see the reality, and we are a bonded family, stronger together for ourselves and for the public. We will still be here inside these walls, working together and doing what needs to be done, with hopes of saving more lives. I am so blessed to work with an amazing team of physicians, nurse practitioners, nurses, travel nurses, CNAs, respiratory therapists, pharmacists, security guards, housekeepers, dietary workers, resource managers, radiology techs, lab techs, etc., who show up for every shift, alert and ready for whatever comes our way. We are in this together. To everyone who feels led to protect vulnerable neighbors and family members, and to everyone who feels led to make the choices that need to be made to save the lives of others, thank you. This healthcare provider sees you and appreciates you so much. Thank you for leaving yourself at the door and for extending your thoughts and actions beyond yourself through precautions for the benefits of countless others. We may never know how many lives you have saved with your choices. Thank you for helping us help our communities. My hope is that our love for people and the earth around us continues to grow on throughout our future generations. Thank you for listening.